and welcome to Team 7's presentation, Compassionate Healthcare Behaviors for Transgender Patients. I am an MBA student at West Texas A&M University. I've worked in the healthcare industry for nearly 15 years and reside in the San Francisco North Bay area. My background includes extensive experience with quality, regulatory, accreditation, licensing, and risk management. Currently, I work as executive consultant for the Permanente Medical Group in Santa Rosa, California, where a large part of my role is devoted to improving the care experience for all of our patients. I will be completing my MBA with West Texas A&M University in 2017. Today's webinar will provide education and awareness regarding the needs of transgender patients. I first became personally aware of the challenges facing transgender individuals in 2012 when one of the physicians in my workplace was going through the transition from male to female. From a distance, it appeared that she was handling this difficult transition with courage and grace. She had the support of her wife and family. She had written one successful book and was working on a second. It seemed like a wonderful example of a transgender success story. In October of 2013, Danielle received news that her gender reassignment surgery had been delayed indefinitely. Devastated by the news, she committed suicide. Danielle was not alone in feeling that suicide is the only option. 41% of transgender people ages 18 and over have attempted suicide, which is 9 times the U.S. population lifetime prevalence of 4.6%. The needs of this patient group are unique. Healthcare settings have not proven to be a safe place for transgender people. 28% report they were victims of harassment while in a healthcare setting. 19% report they were denied medical care because of their transgender status. Today's educational webinar focuses on the healthcare challenges facing transgender patients and the unique needs of the transgender patient population. We will give you communication tools to assist healthcare providers in delivering compassionate care to transgender patients as well as to the LGBTQ population at large. In a few moments, you will hear from my colleague Erica Colgrove. Erica is a senior recruiter at Providence Health and Services in Portland, Oregon, in her first semester of the MBA program with a healthcare management emphasis at West Texas A&M University. Gerardo Alvarez is a program coordinator at Texas Tech University Health Sciences in El Paso. He has been a co-presenter at the Society of Teachers of Family Medicine Conference and is the co-author of several peer-reviewed articles regarding community faculty retention and integration in medical student education curriculum. Gerardo is a 2017 Healthcare Management MBA candidate. Quincy Edwards lives in Houston, Texas, and is currently working as a second-grade teacher while pursuing his MBA in Healthcare Administration. Prior to teaching, Quincy was the administrator of a nursing facility. This is his third semester in the program at West Texas A&M University. Each of these people will give you the information you need and the methods you may use to ensure your transgender patients receive compassionate care. From eye contact to terminology, signage to educational materials, there are many ways we can earn the trust of our transgender patients because everyone deserves high-quality, affordable, compassionate care.
Thanks, Megan. Hi, I'm Erica Colgrove, and I want to start by walking through some helpful definitions and terminology. Transgender, an umbrella term applied to those whose gender identity is not the same sex they were assigned at birth. Transgender man. Trans man generally describes someone assigned woman at birth who identifies as a man. Transgender woman. Trans woman generally describes someone assigned male at birth who identifies as a woman. Additionally, sometimes trans women identify as male to female, MTF, M2F, or trans feminine, and sometimes trans men identify as female to male, FTM, F2M, or trans masculine. It's always best to ask before identifying somebody. Transition, the process of changing one's gender expression to match their gender identity. And genderqueer, a term applied to individuals who do not identify within the gender binary. Cisgender, someone who's not transgender. Gender dysphoria, anxiety and or discomfort regarding one's sex assigned at birth. Gender expression, the physical manifestation of one's gender identity through clothing, hairstyle, voice, body shape, etc. Someone with a gender non-conforming gender expression may or may not be transgender. Gender identity, a person's internal, personal sense of being a man or a woman, or someone outside of that gender binary. For transgender people, the sex they were assigned at birth and their own internal gender identity do not match. Now that we've covered the definitions, let's discuss the power of the pronoun. What is a pronoun and why is it important? How should receptionists, techs, and physicians address these patients in a compassionate manner? It's important to use the correct pronoun when addressing transgender individuals in a healthcare setting for multiple reasons. If incorrect pronouns are used, it can make a person feel disrespected and invalidated. As people are especially vulnerable in a healthcare setting, it's particularly important to maintain a respectful and supportive environment. When addressing a patient in a healthcare setting, and you're unsure which pronoun a person prefers, listen first to the pronoun other people use when referring to that person. If the patient is alone or unaccompanied, you may ask which pronoun the person prefers. You can do this in a tactful way by providing the pronoun that you prefer as you address them. For example, "Hi, I'm Erica, and I prefer the pronouns she and her. What about you?" If you don't know, ask. Now let's look at an example. In example 1, we have 3 different options. A, Brittany is a transgender. B, Brittany is transgender. Or C, Brittany is transgendered. Which one is the correct option? The answer is B, Brittany is transgender. Example B is correct because transgender is an adjective and should not be used as a noun or verb. Let's look at a true or false question. Transgender and homosexual can be used interchangeably. True or false? False. Now that we've covered information about the power of our words, Gerardo is going to discuss the concept of microaggressions.
As Erica mentioned, words hurt, and LGBTQ bullying should not be taken lightly. As healthcare managers in our respected institutions, we must push to create a safe haven and care for all people. Microaggressions to the LGBT individuals seem to be a daily routine in which all of us are responsible for the delivery. The insults are often unconscious, unintentional, but can take form of facial expression, body language, terminology, representation, or remarks. Microaggressions are difficult to recognize, confusing to receive, and extremely hard to address. The following steps need to be taken to prevent microaggressions in the workplace. The first step is to stop using heterosexist or homophobic terminology. Anytime an individual uses any derogatory term, a healthcare professional must respectfully make the individual think what was said. The intervention is vital, and the healthcare professional may ask the speaker to elaborate so they can become aware of what they just said. discontinue the endorsement of heteronormative culture and behaviors. These aggressions take place when the LGBTQ person is assumed to be heterosexual and therefore are encouraged to act and behave that way. One should not assume the sexual preference of an individual and should allow any individual to express their status if they are comfortable sharing it. Next, we must not generalize the LGBTQ community. An assumption of universal LGBT is something that needs to be avoided, as people could falsely assume that all LGBTQ people are the same. It is intolerable to think that a homosexual man should act more feminine to fit in as gay or a lesbian woman to act more masculine. We must stop labeling. Standing behind the LGBT community against pathology profiling. As healthcare professionals, we must push for the FDA to repeal the federal ban that states that any gay or bisexual men who have had sex with another man in the past 12 years are not allowed to donate blood, even if the man is HIV negative and in good health. Being proactive in taking those steps will greatly aid the reduction and prevention of microaggression in the workplace. Transgender members of the LGBTQ community face unique issues when it comes to healthcare. The following clip addresses how healthcare providers can tend to the needs of transgender patients. Now that we've covered information about how to deal with the microaggressions, we're going to discuss patient safety for the transgender person. Transgender individuals face unique barriers to healthcare that should be addressed by healthcare professionals. Outside of the immediate healthcare setting, factors such as housing, violence, and unemployment can have a great effect on the health of a transgender patient. Lack of support in a family setting can leave transgender patients exiled from family homes, leading to homelessness. Discrimination can lead to acts of violence and unemployment. These factors do not allow for transgender individuals to feel safe or healthy. If transgender individuals are preoccupied with the issues surrounding these aspects, they are not likely to focus on their health. These factors also cause many transgender individuals to suffer from mental health. I discussed the issues concerning the health of transgender patients because it is necessary to have an understanding of factors outside of medical issues that face a population. In order to properly treat an individual, medical staff should be properly trained to do so.
Lennoxville Hospital nurse Rachel Liberto wants to make health systems a friendlier place for the transgender community.
I'm a member of the LGBT community, and it's sad to know a lot of people I love and care about will not seek medical attention or seek health care because they're afraid of being treated poorly.
Many transgender people face so many different barriers.
To help its staff further reduce those barriers, Lennoxville Hospital hosted a seminar with Nathan Levitt, a community education nurse in New York City who identifies as a transgender man.
I think that the most important thing is that the healthcare providers anywhere along the team is aware of the transgender health issues so that they provide more sensitive and affirming care, so they know the right names to use, pronouns.
Specifically, I learned how to speak to my clients what specific questions to ask, what pronouns to use, and I knew a lot of the things, but I got some specific hints on how to actually speak to my clients more effectively to get their trust.
For someone like me, I have to always make sure it's a sensitive place before I go, and that doesn't always happen. People don't know my health issues, or I spend 20 minutes in my 20-minute session with a provider educating them on what my health issues are, which of course doesn't help me in the appointment at all.
Small steps like gender-neutral bathrooms can go a long way in making hospitals more welcoming to transgender patients.
I'm impressed that it's here and that I can at least let patients know when you go to Lenox Hill, you'll have an option for a bathroom.
By taking these steps to make transgender patients feel more comfortable, Nathan said it improves their long-term health.
They start to take care of if they have chronic health issues like diabetes or hypertension, because they start to feel more comfortable in their bodies.
There are trans patients that we have, and we need to know how to speak with them and work with them to make them feel comfortable and accepted.
In a healthcare setting, training medical staff to properly treat a transgender individual respecting bodily privacy is key. Also, LGBTQ-friendly healthcare facilities must be proactive in making transgender patients feel comfortable. The areas of focus should be on creating an environment where transgender patients can express how they would like to be addressed and what gender they identify with. In regards to patient self-identification, calling a patient by the proper name and pronoun is a very important first step that can set the tone for their entire healthcare experience. Updating patient forms to include all genders is a step that healthcare facilities can take, as well as offering gender-inclusive bathrooms and information resources available to transgender individuals, such as pamphlets and brochures. The understanding and knowledge of healthcare providers. Transgender patients are interested in having a healthcare provider who is knowledgeable with the LGBTQ community and are up to date with medical procedures and the trends in hormone treatment options. Healthcare facilities can also take extra steps to provide for the overall health of transgender patients by providing access to support groups, mental health care, and counseling. For transgender youth, resources for parents should also be provided to facilitate a more harmonious environment for the patient and their family. The following visual presents questions a healthcare provider can ask on an intake form to include the LGBTQ community and make them feel welcome.
Thank you, Gerardo. In conclusion, as mentioned before, the appropriate training and awareness can prepare providers and staff so they are able to provide a respectful and compassionate healthcare experience for their transgender patients. This is achievable by providing a transgender-friendly office environment for patients and staff. A transgender-friendly environment requires staff to call patients by their preferred name or pronoun. The environment also includes incorporating signage and health-related materials geared for the transgender community. To recap, when providing services to a transgender population, key factors that are important to this group of individuals include personal treatment, making them feel comfortable, and being knowledgeable to the barriers that they face while trying to gain and maintain healthcare services. As mentioned before, in attempting to access basic healthcare, be it related or unrelated to gender transition, many transgender patients find themselves denied, insulted, or outright harmed by doctors, therapists, and other medical professionals. Transgender patients who are undocumented immigrants and or disabled face even greater barriers to finding competent and compassionate care. Transphobia in healthcare is unhealthy, and the LGBT community deserves the same care no matter which pronoun is used. In the comment section below and on the discussion board forum, we have included a hyperlink to an online quiz that will test your new-gained knowledge about gender identity and transgender healthcare. Thank you for your participation during this webinar. On the behalf of Group 7, we hope that we have presented a very informative communication webinar training.